is going to do the introductions of our speakers today. Thank you, everybody.
All right, Dr. James Williams is the administrator for the Iowa Vocational Rehabilitation Services, a division of the Iowa Workforce Development. Prior to serving as the administrator of IVRS, Dr. Williams was the chief executive officer of Bloom Consulting, a national provider organization specializing in providing vocational services, evaluations, and training to individuals with disabilities, particularly those diagnosed with autism spectrum disorder. He is also a certified rehabilitation counselor, an advanced certified autism specialist, and a certified special education teacher. He obtained his bachelor's in special education from Sam Houston State University, his master's in rehabilitation counseling from Texas Tech University Health Science Center, and his doctorate of education in educational leadership from Lamar University. He's had the wonderful opportunity to work in both public and private special education with students of all ages in both teaching and administrative roles. His passion for the last 18 years has been and always will be providing transitional and vocational pre-ETS services for students with disabilities. He strives to use his professional and personal experiences with ASD as a catalyst to inspire and educate others to believe in the incredible possibilities for adults and children with disabilities when they receive the appropriate services and accommodations. Brandy McOmber is the Deputy Administrator at Iowa Vocational Rehabilitation Services. She's also serves as the Project Director for the Iowa Blueprint for Change project. Her roles include working closely with the VR Administrator in the operation of IVRS, providing leadership to the division in the areas of federal and state regulations, policy, and internal controls. Serving as the liaison for the State Rehabilitation Council, representing IVRS on the WIOA Core Partner Team, which provides guidance in WIOA federally mandated activities, and overseeing the administration of the DIF SWTCIE grant. She has also worked in rehabilitation counseling field for over 16 years. Welcome to you both, and thanks for taking this opportunity to give us a little bit of our first lunch and learn.
Brandy and you, Dr. Williams, you should be able to unmute yourself now.
There we go. Okay, it wouldn't let me unmute. I was like, I can't talk. Okay, awesome. Well, we're thrilled to be here. We'll start with introductions. First of all, I'm technically off today, but I had scheduled this presentation a while back with Chris, and I didn't want to change it. So that's why my appearance is a bit casual today. My apologies for that. I usually don't wear this when I'm going to present. But we've got a lot of good information to share today, and Brandy and I'll do that. And we'll start with introductions. Obviously, you heard our bios. We've done a lot of stuff. Okay, we've done a lot of stuff. But we both really love what we do. We love VR. And I want to give you a little background from me. So I am actually a former VR customer. I'm a person with a disability. I am a neurodiverse individual. Was diagnosed when I was 12 years old, and certainly got I won't say how old I am now, although it's more embarrassing. I don't know if it's more embarrassing when you're young or when you're old, but we'll just we'll say mid-30s. We'll go with that. And so for me, the work we do is very personal. Particularly individuals on the spectrum is a passion of mine. It's a population I've worked with pretty much my whole life in some capacity. My first job was teaching a summer camp in Texas, which is where I'm from originally, to individuals on the spectrum doing social skills training and development. So big passion of mine. Was thrilled when Chris invited us to present today and share about VR. So that's a little bit about my background. Professionally, I've been here in Iowa since October of last year, so I'm still very much new to the area. I was appointed by Director Townsend and Governor Reynolds at that time to take over from our interim administrator, Brian Dennis. And really since then, we've hit the ground running. It's been 6 months that I've been in this role. We've made a lot of small and large changes, but we are frankly not really even into the deeper stuff yet. And so I'll talk a little bit more about our redesign efforts as we get into the presentation, but I don't want to spend too much time on them because I want to also get to process and structure and things that you all would really want to know about VR. So if we have time, I'll dive into my 2.0 vision and kind of what we're doing there. But yeah, that's my spiel. I live in West Des Moines, and have the chance to work with Brandy and our amazing team. So Brandy, I'll let you do the same.
Thanks, James. So I would say definitely the difference between James and I is I am from here. So, you know, he's doing an amazing job of jumping in and running, hitting the ground running in terms of learning everything, the ins and outs of Iowa. So while I haven't had to do that, I've learned immensely from just the 6 months that I've been able to work with him. My background and kind of the passion where it came from is one of the first jobs that I held was in a juvenile facility. And really that was for youth who were either adjudicated delinquent or China or a child in need of assistance. And I had the unique opportunity to help build a transition cottage. In other words, a program that for the first time for that agency, we were able to really take a look at youth, especially those with disabilities that were similar to autism or other developmental disabilities or intellectual disabilities, and really kind of come up with an aftercare plan, whether it's signing themselves back in and we continue to work with them, or getting them out there in the community that they're going back to and helping them find work and housing and all those different things. And had a lot of interactions with Voc Rehab and just developed a passion for the amount of change that Voc Rehab could really affect with the different services and the funding that they have. So I would say that is my background. I am in the Cedar Falls area, but I am able to come to Des Moines typically once a week to also collaborate with James. So I would say that's my background.
Good deal. And so I figured we just kind of start out and I'm going to let Brandy take the lead on most of this, just because frankly, I'm still learning our intake process and she's been doing it for decades. So, so Brandy, if you kind of wanted to start by walking everybody through, well, first of all, what VR is. Right? Because some of us on this call may be like, well, I think I know what it is, or I might know what it is, or maybe I know what it is. But we'll start there to get a baseline. And then I think we can kind of talk about our intake process, what that looks like. And then really just, different services we offer. And today, we do a lot. If you do know anything about Voc Rehab in Iowa, we have a great program. We've done a lot of work for a long time. So we could do a 3-hour presentation on our services. We're not going to do that. So instead today, what we're going to focus on is kind of the top level of everything. So you get kind of a nice overview of what we do, and then particularly how you would, get the individuals you serve, whether it's as a professional or as a parent, into, our services. So Brandy, I'll kind of let you take that piece, and then, I'll just kind of pipe in as needed.
Sure. So in terms of the about IVRS, or Iowa Vocational Rehabilitation Services, IVRS is an employment program for individuals who experience a disability. So it is governed by the Rehabilitation Services Administration, or RSA, and it's a mixture of federal and state funding. But essentially, our goal is to, one, provide employment services for those individuals with disabilities that meet their needs and their interests. And then second, to ensure that we're working with our business partners to meet the needs of business as well. We really approach what we do in a collaborative manner. So we like to have kind of a team approach with working with the clients that we serve, which we call job candidates, our business partners, our community providers, different entities that serve the individuals that we serve, and then our one-stop core partners, the workforce development system. We work with individuals from 14 on up, and so we have specific services for youth and students with disabilities, as well as all adults with disabilities. So our mission for VR services is to provide expert individualized services to Iowans with disabilities to achieve their independence through successful employment and economic support. And then the vision is to make a positive difference for every person, one person at a time. So that would really be the kind of the really broad overview of our services. So in order to work with an individual that has a disability, really it starts with a referral process, but it's really flexible based upon the needs of the individual. So it may start with a referral, or anyone can come right into service and apply. So really, with a referral, what we typically see are individuals either self-referring or a referral comes from a variety of different entities that work with that individual. It could be a parent or guardian. It could be someone from a organization such as this organization. It could be a case manager, someone from the workforce system, a teacher, a variety of individuals. And we are able to receive referrals in a variety of different methods as well. So for instance, you can go on our website and there's an online application. Another option is to walk into one of our doors. Another option is to go to one of the American Job Centers and they can get you connected with VR. We have paper applications, and then there's VR counselors and staff housed at either housed in or that cover each high school and college in the state of Iowa as well. And we cover all counties. So going into those settings is another way that you can reach out and apply for VR services, or at least start a referral. So really the focus, I mentioned earlier, is employment. And our regulations are really focused on what's called competitive integrated employment. So that is really the idea of not just a job that's maybe in a setting that is maybe contained and not in the community, but instead a position that's integrated, where an individual receives the same opportunities for advancement and benefits, and is working alongside those individuals who are non-disabled or considered to not have a disability. So that's really the ultimate goal for all of the VR services. It could be a number of things that an individual needs to get there, if you will. So for instance, it could be an individual needs to go to college to achieve their vocational goal and then work with VR, or they may need a number of services such as assistive technology, in order to achieve that. So ultimately, regardless of what that is, the goal is always competitive integrated employment. And by submitting a referral or an application, we make that assumption that that's what an individual wants. In order to really move forward after a referral is received, if a referral is received and somebody doesn't go straight to application, we really want to make sure that we reach out then when we receive an application or a referral, and we contact the individual and the individual's parent or guardian or legal guardian if they have one. And the reason that we do that is there's a number of documents and paperwork, medical documentation, and sensitive information that we require based on our regulations to receive an application. And so we always want to make that connection with the individual that they work with if there is a legal guardian, because we can't proceed very far with an individual if that is a requirement. So we do that contact immediately or within the first 2 weeks. So if an applicant has a guardian that's a legal guardian, or if the individual is considered a minor, then really we inform those individuals that the participation of the guardian is required to move forward with an application for services because of what I mentioned previously. At that point, within 10 days of the receipt of a referral, we like to reach out and make sure that we have an appointment scheduled for the individual. We offer group orientation. In other words, they can come in with a group of individuals and get kind of an explanation of services and what we do. The other option is an individual orientation. So for instance, if there's a student in a high school that is requiring services, their teacher may refer, and then we usually have, as I mentioned, a counselor or a staff that cover that school. So it's just the next time that individual is going to the school, they will be able to set up and communicate with that individual. So it doesn't necessarily mean a group orientation, but instead it's an individual orientation with the student and their parent or guardian. So once, and I should say the purpose of that orientation is really to provide the full information, because in our regulations, we're really required to provide information so that an individual is really well informed and can make the decision of whether or not they want to proceed. And so that's the purpose of that. But in order to really move forward with that, we want to make sure that they really understand that, one, they know what our services are about, and two, that we will require specific information in order to make them eligible. So in order to be considered an applicant, an individual has to complete an application for services. Once again, we can do that online, or through a paper application. And we can even accept some of the common applications that a one-stop center or American Job Center has, if it includes the information that we need. Otherwise, an individual can just contact us and say, I'd like to proceed with services, and we can help from there. The other part of being an applicant is, has that individual provided the information necessary to initiate what's called an assessment to determine eligibility and determine their priority for services? So in other words, we have to have full information to be able to make someone eligible. And that could include medical documentation. So we have to have a documented diagnosis, in other words, in order to proceed. We do ask that all of our applicants be active and full partners in the process. And what we mean by that is, we really, since our services are all about employment, and our services are all about, moving forward with getting a job and diving into information that helps really achieve a individualized plan of employment that is unique to that individual, we need to have participation. We need people to attend meetings, but we also understand that the nature of certain disabilities makes that difficult. So we like to work and meet an individual where they're at. So really then what we're doing is meeting with the individual and learning about their unique strengths, the resources that they have, their priorities, their concerns, abilities, capabilities, and informed choice. I know that's a mouthful, but those are all the things that were really required in our federal regulations to touch on. And informed choice is an important one. In other words, are we really diving in and providing enough information so that an individual can say, yes, that's what I want to proceed, this is what I'd like to do. So then we do the application, we gather a lot of information about the individual. We try to do that in as sensitive of a manner as possible, because, when you're diving into very sensitive disability information, that is tough for some individuals. So we typically like to set up a series of meetings to really walk through and get to know that individual. In order to do eligibility, one of the things that we'll do in that application process is to sign some releases of information. Releases of information are really required to gather that medical or whatever other documentation we need to make that eligibility happen. And an eligibility for services is really about 3 prongs. 1, the individual has to have that documented physical or mental impairment. 2, the individual's impairment must constitute or result in a substantial impediment to employment. So in other words, there is a need in terms of their employment services. They're not able to just be able to go out there and achieve it on their own, because the 3rd prong is they must require our services to either become employed, maintain employment, or advance in employment. So we can work with individuals who, even if they have a job, they may be coming back because they once again need VR services, because now they're at a point where they want to advance in their employment, and that's really tough based on their disability. So all those things can occur. So really that is that first step in the process, the referral all the way through the application and eligibility. I'll stop there just in case, I know that was long-winded, in case anyone has any questions or you want me to cover anything else.
And if you do, feel free, and I forgot to mention this earlier, but for questions, I know sometimes it's easier on Zooms to drop them in the chat, and that way you don't forget it, and then we can get back to it. So that's probably the best way to do it. But feel free, if you want to come off microphone and ask questions, that's fine too. But if you want to, put them in the chat, and then I'm keeping an eye on it, and then we'll make sure to go back and answer anything that you have. The other piece I'd like to add is, we recognize that the VR application process is lengthier than we would even love it to be. To be honest, a lot of it has to do with federal requirements. So one of the things that we've tried to do as a state is make it as easy as possible with the parts that we have control over. So one of those things is putting the application online. It didn't used to be. One of the, I guess, positive parts about COVID is a lot of agencies were able to say, if we don't already have it online, we probably should now. And so we were able to do that. A lot of other VRs across the state did that, or across the country did that as well. And so that's one of the ways we've made it easier. But we also tell people, if you have questions, ask, right? Like, we get this, especially for individuals that maybe are applying for the first time, or maybe are younger, and this is one of the first services they've ever applied for outside of school. We recognize that they're going to have questions, whether it's them, their parents, or both, and that's totally fine. So I do encourage people to reach out to our offices. I didn't mention this earlier. We have 13 area offices across the state of Iowa. And in addition, we have several more satellite centers at colleges and other locations. Chances are we're close to where you are. And so one of the things that you can also do is if you want some help in person, let us know. And whenever our staff are there, they can set up an appointment to meet you at the office that's closest for you. We do that all the time, every day. So that's one thing to know as well, and something I'm really proud of. I think we probably, for state service, probably have one of the best and largest footprints in the state. So I think we do a good job with that. And what's great too about our teams in our local offices is they also know the communities really, really well. So they're also an individual that you can reach out to them, and they probably can not only just help you apply for our services, they probably can tell you about other ones too. Or if there's something you're looking for and you haven't found it yet, they're great resources for you to provide, or to provide that information to you. It's one of the reasons why during the recent alignment, as of July 1st, we moved from Department of Education to Iowa Workforce Development. And it was for a lot of reasons, but the two primary ones are, one, the primary purpose of VR is employment, right? We tell people all the time, we'd love to help people achieve other goals as well, but that's really not how we're funded or why we exist. We exist to help someone, as Brandy said, achieve employment, maintain employment, or advance in employment. So now there are a ton of services that you may think of that you may not know are related to that, and that actually might be, but it all has to go to a vocational goal. It's one important thing. The other important thing to know is part of why we came together with IWD was to also do a better job of referring people to other services across the core partners, which Brandy referenced earlier. I won't go into titles 1, 2, 3, and 4. We're title 4 in case you're wondering, but you don't wonder. It's a whole thing, but it's a whole job. But basically, you know, by being a part of IWD, we're able to do a much better job now of referring people to other services too. And so, for example, I'll give you a good example. You may work with us to fund your services, build your plan for employment, all that. But let's say you just need help while you're waiting on that, or while we're doing that, you need help getting a resume done or a cover letter done for a part-time job you want to start because you're coming out of school and you want to get going. Our partners at the American Job Centers can help you do that while you're still working with us. And that's one of the things that we're really trying to do a better job on statewide, is we're trying to make sure that anybody who comes to VR is getting the entire menu of services that Iowa Workforce Development offers, because it's a lot more than just VR. So I think that's a really big thing I would emphasize, and vice versa. Sometimes what happens is, not sometimes, it happens a lot actually, people will come to American Job Center and have a disability and they've never heard of VR in their life, especially if they're older and they didn't hear about it in school. They have no idea we exist. And it's the same purpose, right? They go to the American Job Center, they get help, and then the American Job Center, or we call them AJCs for short, they say, hey, have you heard about VR? You may want to apply because they probably could help you. And we love that too, right? We love that go in both directions. So just know that's one of our goals, especially right now. And we're putting some initiatives in place to actually even increase the number of what we call co-enrollment across programs, because we want to make sure that Iowans with disabilities are getting everything we can offer, not just VR, not just American Job Center services. There's even some other great services for veterans and other specialized populations that, again, you could get in addition to what you get from us, or in addition to what you get from an American Job Center just walking in for, for resume help or to apply for jobs or unemployment, things like that. So really great resources there as well. And so just wanted to kind of share that broad piece. And again, if you have questions, as Brandy dropped in the chat, our website, I will tell you, our website is good, but it's not great. We know that. I'm very excited to say about the end of this month, the 23rd is the target date, but let's just say the end of this month in case anything happens. The website will actually be redesigned, and all the information that's there now will still exist, but it'll be much easier to find. It'll look a lot nicer. It'll be much more accessible and much more readable with a screen reader. And there's some other accessibility enhancements we're making. So really excited about that. So look towards the end of this month, you'll see a new website launch for IVRS, and it should be even easier than it is now to find things. And some of that also has to do with, we moved our content from the Department of Ed to us, but it kind of was a little clunky in that move. So we're trying to basically get it kind of pushed back into IWD to where it's easier to find us on the website. So just know that that's coming as well. I know we had one question that popped up in the chat, and then we'll jump back in. Brandy, this is a great one. I'm sure you could answer that one.
Yeah, so the one thing that I hadn't mentioned is what's called our pre-employment transition services for potentially eligible. And that's potentially eligible are those individuals who have not yet been made eligible by our services, but that they meet the criteria to receive certain services that are unique, because but without being in that category, you wouldn't be able to receive services without going through our eligibility process. So I wanted to touch on that. Pre-ETS or pre-employment transition services are available to those individuals who are between the ages of 14 and 21 that are on either an IEP, that education plan in high school, or a 504 plan, which is the accommodations piece, or that the school has deemed that maybe they don't have a 504, but based on a disability, they would meet those requirements. So those services for a high school graduate can actually start uniquely before we even sign them up, if you would. And then they can continue, and the length of services is really all based upon what we call our individualized plan for employment. So after a person is eligible for our services, we work towards that plan for employment. And it's really, once again, based on the unique needs of the individual. How do we get them to their determined employment goal? So the VR counselor and the individual work together to achieve that goal. So for a high school student, for instance, they may want to go to college. So we would, if we sign them up as a 14-year-old freshman, we may be working with them all the way through the 4 years of school, plus maybe a 4-year education or a 6-year education, and then the amount of time it takes to get a job. Whereas some students, maybe they're signed up in the senior year and they just need some typical job assistance. They're not going to college. So it can really be individualized based upon the needs of that specific student, if you will. And so that goes with both students and adults. It really is based on what that employment plan says. So the key aspect of all of our services is working jointly to really add into that plan everything that the individual needs. And then part of that plan is kind of the timeline of what we expect, kind of an anticipated goal date. In other words, when will they have been on a job for at least 90 days, which is when VR typically is the earliest we can close out services for somebody who's obtained work, if you will. So that's kind of the long answer of how long. It really is dependent upon the individual. Now, if someone relocates, if they're relocating within the state of Iowa, we can just easily transfer. A lot of our files now are all electronic. So we are just entering something into the system and it transfers them automatically to the VR agency. We do have an Iowa Department for the Blind in Iowa. So if an individual is a person with a disability who has blindness or meets their criteria, we cannot provide services and we have to send that referral over to them. But if a person relocates to another state, we do not have any mechanism to just transfer it. But what we would prefer to do is a warm handoff. In other words, we can set up and provide that individual with the contact information and even make a call to get that set up, if you will. So we are able to, make that connection. What the regs do allow us to do is also to have dual case files, but what we have to make sure of is if somebody's in another state, we have to make sure that we're not duplicating services. So in other words, if they transfer to another state and they're wanting to keep services, let's say they're going to college, then we would have to get a release and work with that other VR agency to ensure that what one is providing in a plan for employment is not what the other is providing. So we kind of work jointly together. We got another question here that was sent. It says, with the third option being based on the disability to get into pre-ETS, is there additional information about the specifics? Absolutely. So if you go to our website, we have a entire page on education, and there's a section on just education in general. Then there's high school students, there's parent resources, there's post-secondary education.
Reliable too.
All of it is located on our website, as well as what a specific page related to the pre-employment transition services. So yes, there's a number of options there, and it's all listed on our website. And we also have a contact section that you can put in the county or whatever it might be, and you will receive a contact that can provide you, with more information. It looks like we had another, if someone is diagnosed with developmental disabilities or neurodivergence later in life, how can one as an adult with work experience and these invisible disabilities appropriately express one's needs? Great question. So that's one of the reasons that we really, like I mentioned before, we want to make sure that if there's those, we ask about like the resources, the needs of the individual, parent, guardian, those support services. We prefer, if the individual is okay with it, to get releases of information so we can communicate with the person's whole team, if you will, so that if that person is comfortable with it, we're able to really communicate and collaborate and even co-enroll that individual as needed. And the other component of this is hopefully some of that is in the medical documentation or records, which is part of that eligibility process as well. Oftentimes why we're gathering multiple sources of information is because maybe one doctor just says a diagnosis, but maybe the individual is working with another entity that can provide that background information that the person may not be able to fully express on their own. So there's a number of ways that we do that, but we are very aware that we do not work in a silo. And so it takes kind of that whole resource team to make an individual successful. Okay. Anything to add there, James?
No, no, and I think, part of it, and we'll spend the time we have left, Brandy, just kind of talking a little bit about, and again, if guys, if questions come up, feel free to drop them in the chat, and we'll basically, as soon as we get to a break point in what we're sharing, we'll just stop and we'll answer them like we have been. But I think, one of the things that keep in mind, and Brandy mentioned this a lot, is we really want our services to be individualized. That's really important. So for instance, we'll share in a moment some of the things that we offer. But not everything is for every person, and we certainly don't intend it to be that way. We have some specialized programs. Some of those specialized programs aren't appropriate for some of the people we serve. Some of them are. Some of the programs that we offer don't, the person doesn't really have a need for it, and that's fine. So they don't do that program. But I think we've done a really good job, at least Brandy and our team have done a really good job in trying to make sure that we have options available for as many of the needs that we can think of or identify or have seen in Iowa. And a great example, and Brandy, if you want to talk a little bit about IBC and what the blueprint is, I think it'd be great. But there's a lot of work that we've also been doing as a state focused on individuals that have more significant disabilities and individuals that maybe want to pursue. For instance, you may not know this, but nationally, Iowa VR is recognized leader in individualized self-employment. And in self-employment in general, we actually kind of lead the way. In fact, one of our staff members is presenting at a national conference next week about it. But so we've got some really great programs as well. And our self-employment program is a really neat program, one of many, but a really neat one where individuals are able to start their own businesses with support from VR as part of their employment goal. And they do incredible work and all types of different work. I can tell you, we have individuals that do work with machine type work. We do individuals that do more kind of what I would consider like artwork and artistic type engagements and talents. We have individuals that do all kinds of different things. And so that's also another nice thing as well is when we're talking about work, we've got a lot of services that can address a really wide scope of what work is to the individual. Like what is work to them? What are they looking for? For some of the individuals we work for or work with, they're really just looking for a part-time job at, a retail or a food establishment. That's what they want. That's what they need. They just want to make some money. Maybe they're going to college. Maybe they're saving up for a car, lots of different situations. That's fine. If that's what their need is, we're happy to help with that. We have other individuals that are like, I really want this kind of higher level job. And in order to get it, I have to go to this training program or I have to go to college. That's great too. We can support that and help with that goal. Just as important, just different. We have individuals that maybe have significant disabilities who, for them, work is going to be really specialized, right? How it's going to look, what it's going to look like, what environments they can work in are really, really specific, okay? That's okay too. We'll help them find that. We have a whole process called discovery where we literally figure that out with the individual. It's a really cool process, actually. And so there's lots of different things that we can do. So I encourage everyone today, if you get nothing from what Brandy and I have said, A, we have some great services, and B, we view work with a very, very wide lens. And so really think about that today. That's my whole goal. The saddest thing I will tell you I've heard, and this, I didn't hear it in Iowa, so which is good, but in Texas, where I used to be a provider and did a lot of work, parents would tell me, well, my son or my daughter wants to do this work and VR doesn't really help with that. And that would always hurt my heart because I know that's not true. It's like, yeah, they do. Maybe the counselor you had didn't know that, or maybe they were new, or maybe there was a miscommunication, but they can help with that. And so keep that in mind. Even if you're like, hey, I don't know if that's a job, We have individuals that come to us all the time and say, hey, I want to do this. Is that a job? Or I'm not sure if it's a job, or I'm not sure if I can do that job. Those are great questions, right? Like, you don't have to come to us. I'm not going to lie. We have some people that come to us and have plotted it out and are ready to go and say, hey, can you help me? That's great. But then we have a lot of other individuals that just have no idea where to start with work. And that's really where we focused our pre-employment transition services and our work with schools across the state, is helping individuals get I don't want to say a plan, but get a better sense of where they are. And that way, by the time they are ready to start eligibility and get into services with us, they at least have an idea of what they want to do. Maybe they don't know the name of the job, but they know the area, or they know the type of job or the type of work and functions and tasks they want to do. So a lot of great work that can be done there. And then Brandy had dropped in the chat. That's about our DIF program. And so, yeah, Brandy, I think kind of now we'll shift into discussions of just kind of general services we offer. And then if you want to share a little bit about the DIF.
Yeah, sure. So, yep, like James had mentioned, the specific page for our Iowa Blueprint for Change, or DIF grant, is listed there. Once again, I will note that it's a terrible page. I mean, we know that we got to fix it, but we wanted to just get as much information as we're working on updating the website out to individuals as possible. So just diving into the DIF grant quickly, really this was a really cool, unique opportunity that we were awarded along with 13 other states to be able to provide innovative services to individuals who meet a certain criteria. And really that's those that are either considered to be in sub-minimum wage or below minimum wage employment, or those contemplating sub-minimum wage. And they allowed us to define that ourselves. And what we really thought is, in Iowa, we don't really have a sub-minimum wage issue per se. There's not a lot of those out there. But what we have is a system that's really focused on maybe rehabilitation or non-employment settings for individuals with autism, intellectual disabilities, and any of those that have more significant disabilities. So we were awarded almost $14 million to really improve the systems across Iowa, working on a number of objectives. And one of those is really to develop a collective of stakeholders to really talk about what's going on in the state of Iowa and then dive in and do the work. So on that website, the webpage that I shared, there's a little section called the IBC Collective. And that is that large group of anybody who's interested in making change in the state of Iowa for individuals with more significant disabilities. And we have a series of different work groups within that collective meeting. So first you'll hear information, we'll give updates, and then everyone can dive in and choose what work group that they want to work on, or just sit and listen. And then we also do newsletters and other things there, but you can really kind of get a feel for what we're doing there. Just some of the highlights of things that we're doing is we're looking at not only developing communities of practice and sharing information, but connecting with the other professionals that work with individuals with disabilities. We're looking at starting a direct support professional registered apprenticeship and quality pre-apprenticeship program to really ensure that we have the professionals that are fully trained in the state of Iowa to work with individuals with disabilities. We are starting up some youth pilot sites to really look at how do we get individuals really earlier in the transition setting to sign up for all the services that they need, to train the teachers about the services, and really push that competitive integrated employment option for those individuals with disabilities who need it. And then we're able to set up some really neat programs such as customized employment and IPS, or individual placement and supports. So we have some pilot sites where we're working on a number of different manuals and information resources for individuals and parents and families and providers. And then we're also looking to try to support and provide information to really push the idea of some actual public policy for employment first and technology first for the state of Iowa. So if you're at all interested, we accept anyone who's wanting to learn more. There's also a sign up on that page that you can sign up and say, please give me more information, and we'll reach out to you. Okay, so that's that part. In terms of just our general services that aren't DIF related, we actually have our federal regulations really kind of mandate what services we can provide. So if you're ever bored and interested, it's 34 CFR. It's the Part 361 series that we really focus on. So the services that we can provide, once again, this is kind of a really broad range of services, keeping in mind that everything is once again, as James and I had mentioned previously, streamlined around what that individual needs to be successful in competitive integrated employment in the goal that they jointly chose. So in other words, not everyone will require all these services or be interested in these services, but these are the ones that are typically available. So some of that are services such as assessments. So, that might be an assessment that we're providing to learn more about that individual, to learn about their work skills, even assessments to really help identify what other services that they may need. We offer everyone what's called vocational counseling and guidance. So that's really providing that that it's not mental health counseling, nothing like that. It's strictly vocational, providing that intensive counseling and guidance service to really help an individual get to know themselves and understand what's available, and really walk through the process, talk about fears about working, all those different things. We always offer information and referral. That is one service that anyone can receive, whether they're working with us or not. We provide that to anyone that's interested. And that's really looking at any, state level or local programs that are available to an individual, or information that they need, maybe even if they're on a waiting list for VR. We offer something called physical and mental restoration services, and that's really helping with, some of those different, like whether it's a surgery, we've had cochlear implants, those kind of things. And once again, we always have to look at comparable services and benefits. So sometimes it's not providing the service ourselves. It's obviously, connecting an individual with what that service is. And we offer a lot of vocational and other training services. So whether that's post-secondary training or a continuing education training, or even, sometimes assistance with training on a specific disability, whatever it might be, we can look in and explore that with an individual. Maintenance and transportation or other services. Transportation is obviously based on the need, once again, but it could be helping with bus passes. It could be, a taxi. It could be a flight, depending upon what that individual needs based on their goal. Maintenance is about those different kinds of things like housing, lodging. We don't offer assistance with like rent, anything like that. It does not allow us to do that. But for instance, if an individual is going to a training in another area and they need to stay in a hotel, we can assist with that. This also covers things like interview clothes for an individual if that's a need for them. We offer some services to family members. So for instance, if an individual requires, let's say, transportation and a family member can provide that, we can assist with that to get the individual where they need to go. Interpreter services, so sign language, oral interpretation services as an example, as well as language interpretation. Reader services, job-related services, job search and placement, supported employment, personal assistant services. So if that individual has a need for a personal assistant, we can provide some compensation for that. We also offer assistance with occupational licenses, with tools, equipment, stocks and supplies, those types of things. We offer assistance with rehab technology, might be things like hearing aids, glasses, other devices that an individual needs, assistive technology devices, as well as transition services for students and youth, those going into or in high school and college settings. And then technical assistance is another one that could be that self-employment that James mentioned, as well as customized employment. And then kind of a broader category is just other things that maybe a person needs that that maybe isn't necessarily fitting perfectly in one of those areas that I mentioned. But like James had mentioned, we also have, we cover all the colleges in the state and We cover every high school, and then we have those 13 area offices as well as those satellite offices. So really, when an individual is interested in what services we provide or what is out there, there's a number of ways to gather that information. I'm trying to think, is there anything I missed there, James?
No, I think you hit, that was perfect. I was hoping, because it's hard. We can get, each of those services could be its own presentation. I'm not kidding. So that's that gives you kind of a nice rundown. I think one service I'd add, just, Brandy talked about our pre-employment transition services. One of our colleagues, Mary Jackson, is kind of over that for the state of Iowa on our team. And she's not here today, but one of the cool things I will tell you, we do some really neat, and each office does different things. So I couldn't tell you what they're doing because every office does something different. But a lot of our offices, or most of them, do some type of summer programming, also for pre-ETS. So they'll do some type of, and basically just as a premise of what pre-ETS is, and the simplest explanation is it's training for somebody that isn't trying to get a job today, but they basically need training on skills to get ready for a future job in the near future. And so those 14 to 22-year-olds, and it covers everything you can imagine, from soft skills development, mock interviewing, resume development. I mean, you name it. Pre-ETS is very broad. It covers almost anything you could think of, probably could fit into one of those categories. But my point being is that's also a really great service that individuals can access. It's a service that doesn't require the full eligibility process, which is awesome, right? So they don't have to do the medical documentation review, all the things that Brandy talked about in the beginning of our presentation today. In most cases, those services can be provided without that level of process. Now, we still need some documentation, but it's vastly less than the full eligibility. But and that's because we have federal guidance and allowance to do it that way. The other piece that's really cool is sometimes those services can look more like training classes. Sometimes they can look more like camps. Sometimes, again, each one of our offices, they're actually going through that process now of proposing and setting up their summer programs and services. But those can be really great resources as well. If you have an individual at that school age and you're not sure who their counselor is, what your closest office is, again, our website is a great resource to start with, and you can look at where our offices are, what one is closest to you. And also, if you call the wrong office, it's never a big deal. They'll tell you, just tell them where you live, and they'll tell you, hey, you probably should call them or what have you. I think our offices actually do a really good job of doing that. They know their service territories better than I do. And so I think that that can be a resource as well for those services. So encourage you to utilize that and ask for that support as needed. Last thing I would share is again, all of those services revolve around work. Now, one of the interesting things that we recognize is we have a lot of individuals that we serve that are served maybe by Medicaid waiver services, or maybe they're getting served by us while they're waiting on the wait list for Medicaid waiver services through Health and Human Services. Now, those services are separate from us. We don't control them. We don't have a say in how those go or how those are run, but sometimes they are very complementary to what we do. So, for example, an individual may be getting some services through their Medicaid waiver through HHS, and then they may also be getting services from us that are different from those services, and then they may be getting services from somebody else. And that's the goal, right? The goal is that people get what they need. And like Brandy said, it doesn't all have to be us. Being transparent, our budget is a fraction of the size of Health and Human Services. And I'm telling you that because there are a lot of services that they can pay for that we, A, can't pay for because of policy, but B, we also don't have the funds to pay for them even if we could. And so we recognize that, and they recognize that about us, that we have some funds set aside for things like pre-ETS that are specifically focused on things that they don't really do. And so I encourage people, know what's out there, right? Don't just talk to us, don't just talk to them, talk to both of us, and see how we can support you. The worst thing that could happen is you may find out, hey, everything you need, you're already getting from somebody, and there's nothing else we can do for you. Still be glad you made the call, still reach out to us because we still want to make sure that we're getting you what you need. Vice versa, there's many times when people say, hey, we want the IVRS to pay for this. We say, well, we can't, but you know what? Medicaid waiver might, or this organization might. And so talk to them and see what they can do to kind of fill in the gap. And I think that's a piece that we have been working really, really strongly with our staff on. That's something that Brandy and the DIF team have also focused on, is how do we continue to educate our staff, especially when they're newer, to all the different resources and services that we have in the community. And so, that's a big piece that we focus on a lot. And those resources and programs change too, right? Our providers change what services they offer. New programs start all the time. New providers start all the time. So, I also tell people is that, what may have existed then doesn't exist now, or hopefully vice versa. What we maybe don't have now, we may have in the future. It also varies regionally, right? There's different services offered across the state. So there may be services in Des Moines that aren't offered in, another part of the state, vice versa. There may be services in Cedar Rapids that aren't offered in Des Moines. And so keep that in mind as well. That's why we encourage people to really work with our local offices, because they know the providers in their areas. They many times have personal connections or contact information for those providers. So they can also help as part of that information referral that Brandy talked about to really get the person to the right individual. But again, ask those questions. I can't emphasize that enough. I also would want to add, don't wait to get involved or connected with us, even if your individual is relatively young, or even if maybe you're an adult, but you're not quite ready to get a job yet, but you're thinking in the next couple of years, maybe if you work on some other things, maybe it's chronic health conditions, other things going on that you will want to work, give us a call and start the conversation. And the reason why is there's some things we can do while you're waiting. If it's not the right time, we can still get you in our system. We can still start eligibility. We can still do some other things. That way, when you are ready, if we do happen to have a waiting list or some type of wait for a provider or something at that time, that'll happen that much faster. The other thing too is then you'll know what's out there, and you can start building that plan in your mind of, hey, here's what IVRS can help with. Here's what I'm going to need to find other resources with. So I encourage people to not to wait. I think that's probably the biggest mistake a lot of people make. I don't know, Brandy, if you feel the same way, but that a lot of people make is, give you an example. Their son or daughter hears about us when they're a sophomore in high school, but they don't apply or really talk to us until they're a senior. Don't do that. There's no reason to wait. It just makes it harder in the end. We really, the whole reason we do pre-employment transition services or pre-ETs and all that, the push for that from the federal government is all around this premise that it's not too early to start. That's why we say 14 to 22, and we really mean 14 to 22. And so really, consider that piece as well. Same if you are in a job. Another common thing I hear all the time is people say, well, I have a job, but I'm really not happy with it. So, but VR can't help me because I already have a job. Not at all. We totally, if you're not happy with the job and you're looking for advancement and or there's an issue or a problem in the job and you feel like you need to exit, but you don't know what to do and you don't know if you can get another job, talk to us. Those are circumstances when we can absolutely work with you. As Brandy said, we want, our services are focused on maintaining, right? Keeping that job, getting a new one, or advancing. And so make sure to keep that mindset of pretty broad, because that's happened before too, where I've seen individuals that maybe don't apply to us because they think, oh, well, they can't really help me. We can. Now, the services you get from us are probably going to be different than somebody who's, getting their first job, but we can still help you. Brandy, anything else you would add? I think we,
Nope.
and the time we had, I think that was about the best broad overview we can do. One of the neat things, I tell people too is VR is a national program. We're funded. In fact, we're actually funded primarily federally. It's about I forget the 72%, right? Isn't that? Yeah, 72.3%. Yeah, I'm starting to remember it. And so is federal funding from the U.S. Department of Education and U.S. federal government. It actually comes from a couple different areas, but and then the rest of it is state funded. And our state appropriation is relatively small in Iowa. In fact, we would love for it to be bigger. That's a goal in the future. But as part of that, we have a lot of really great resources, and every state's VR program does some of the same basic services around employment, but then each one has kind of its own unique programs. And like I said, in Iowa, between our collective and the DIF and the Blueprint for Change is one really cool thing we do here. Our ISE and individualized and customized employment, another really cool service that we're doing. So we have some kind of unique things in Iowa that we're really proud of that I think we do really well. But there's always more work to do. And so I encourage you to give us feedback. One of the things I'm going to do now is Brandy, and actually Brandy, you could type it faster than I can. Could you put our emails, both of our emails in the chat? But we'll put our emails in the chat, and that way if you have questions that come up, her and I can be a resource for you. Whether it's, hey, I've reached out to somebody and I'm not hearing back, or I don't know, again, ask us. We're here to be a resource to you. I may direct your email to my staff member that specializes in that work, because I want to get you the best answers possible, but I will make sure that you get answers and I will make sure that you hear back. We exist to serve the citizens of Iowa that have disabilities. That is what we are here for. That is why we are state and federally funded. That's why I'm here. That's why Brandy's here. And so we want to make sure that people are getting what they need, whether it's autism or any other disability. That is absolutely why we're here. We've also done a lot of really interesting, and I think this is a great thing to finish up with. We've done some really interesting engagement and professional development with our staff related to autism. So we've worked with Autism Speaks and a couple of other organizations that have some great employment trainings and some really good employer-like type work, employer outreach work that we've done with our business team. And so we also have done some specialized work in Iowa for individuals on the spectrum, but there's always more work to do, right? There's always more training that can be done. In fact, that's something we're exploring right now, is a potential pilot to even widen the training that we've done on autism to not only more employers, but even more of state government. That's an initiative that that's being worked on as well. We're not there yet, but I think in the future we might be. So so we've got a lot of really cool things that are going on. And then lastly, if you have feedback, please reach out to me. Let me know. Same with Brandy. You know, I always tell people we can't fix what we don't know. We can't make things better when we don't know that they're not better. So please give us that feedback, whether it's an experience at an office, and we love positive and negative feedback. I get it. Things happen. If it's negative, don't feel bad for telling us. Please tell us so we can address it and make it better for you. Whether it's just your case or just helping improve policy across the board. That's one of Brandy's main objectives in her role. But also we love great feedback as well. If you've got a counselor or a staff member that's done a great job with you, we'd love to hear that. We'd love, because a lot of what we do is we try to get our leaders to train the rest of our staff. And so if you've got a great counselor you've worked with, we want to know, because we want that counselor to be a part of training and supporting other people. Lastly, just a thank you to Chris and the Autism Society for hosting us today. I agree. Thank you, Tanya, as well. Really glad that we're able to do this. Certainly won't be the last time that we talk to this group, but just appreciate everybody's time today. And I hope you were able to lunch and learn. I'm going to lunch now, so because I was talking and you don't want to see me try to talk with food in my mouth. So it's not fun. And so again, thanks for having us, and hope everybody has a good rest of your day.
Yeah. Thanks, Brandy and Dr. Williams, and thanks everyone for joining us. All of the information that Brandy put in the chat room, we will email out to everyone who's registered for this Lunch and Learn, so that you will get all of that information as well soon, and you'll have it all in one email as well. So thank you, everyone. Thank you, Dr. Williams and Brandy, for all of this great information and for being here today.
Thank you.
Take care, everyone.
Thank you.